Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. It's nice to be with you folks, virtually, so to speak. This patient is going to be particularly interesting. She's a very good patient. She has a severe case of tetracycline stain. She didn't want her teeth ground down, but she has had some patchwork done in the past. So she's from where? San Francisco? That's right. And she came down here because she wanted to get an attractive smile. What you're going to see today is how to handle tetracycline stain without removing any painful tooth structure. Now we've done some reduction. I removed some old composite that she had on these teeth, and I'll give you an opportunity to look at those teeth in just a minute. But what we're going to do is improve smiles painlessly. We've been doing this for over the past 20 years routinely, and I've never had to give a patient a shot. And so we hear from people what you can't do with Lumineers. And I can always tell an expert on Lumineers what can't be done is by somebody that's never done a Lumineer. So all the people that have never done Lumineers know why they won't work, but they haven't really truly found out or had ulterior reasons for wanting to find out. Prior to placement, you want to have everything ready to go. And so you want to be prepared like a pilot or a surgeon or a chef on television. They always have everything ready to go. And they planned ahead. They're not looking for something at a critical time. So the first thing you have to have is a knowledgeable assistant. Lisa, let's have a roll of the drums. Lisa's been with me 20, 30 years. She started out when she was 6 and been here ever since. The other assistant that pops in and out has been with me like 40 years, so she really has been a very long time. But you need a knowledgeable assistant because she's going to make everything work. Then you want to have a convenient tray set up and have your porcelain pre-treated. So this is what Lisa has done before we sat here in the chair. And she's put Serenade conditioner, and then she's put Serenade Prime on. So they got the porcelain conditioner, which is citric acid. Now, that's a very critical step. It's an organic acid. You need an organic acid to activate your silane. If you use a phosphoric acid like we use on enamel, it won't work because the Serenade Prime or the silane won't get activated. So the maximum strength is activating your silane just before you apply it to the porcelain. And Lisa has just done that. You don't want to try to do these procedures if you have less than 4-power magnification. Can you do it? Sure. Can you do it as well as with 4-power? No. Some of you say, well, he's an older dentist and he needs loupes. Well, that may be. But so many dentists are just fitted with 2.5 times magnification. 4-power is minimum. You'll see me getting close to the gingiva, getting close to the tooth, and with 4-power, you will never, ever touch sensitive tooth structure. Let's talk about the sapphire light. It's a whitening light. A study has just recently been shown that no matter what your chairside whitening agent is, that the sapphire light makes it work faster and gives less light energy. It'll take less than a minute. Actually, it's going to take us 2 minutes to bond all of these in place once we start, because we're going to give them a 5-second curing exposure. Now, the next critical part of this is taking impressions. And when you take your impressions, you always want to pour it. I like to use the Lumineer impression material because it just almost always gives extremely sharp margins. If you'll pour the model before you send it in, you'll find out if you're satisfied with the margins. If you're not, then it's better you find out then and take another impression on your patient before you send it in and have somebody call you and tell you that you need a better impression. So let's talk about today's patients. Why did you choose Lumineers?
Well, I had investigated porcelain veneers, and I was concerned about removing the tooth structure.
You didn't like the idea of having your teeth ground down with
Not at
anesthetic,
all.
even if it didn't hurt?
No,
Okay.
it didn't seem healthy.
And what else? What else appealed to you about? That's why you didn't want other veneers. So why did you
That's
want
right.
Lumineers?
Because I had seen the results, I'd seen some of the marketing,
Mm-hmm.
and I thought the results were so natural looking, so outstanding.
Mm-hmm.
It was really art.
It was a natural smile rather
Right.
than a what do they call those Barbie doll smile?
Right.
Yeah.
And that they had that there was a study done, and that there was a 20-year.
20 years. You really did investigate this, then, didn't you?
I did.
Yeah. We should have had this discussion before. I didn't know you knew so much. We should have you. Yeah. You really are. Okay. So let's take a close. Let's go back on that slide just a little bit. And this is the way she looked when she came in. And I removed a lot of the resin that was on there. And you can see that there's quite a range of chroma on those teeth. And when we get into that, well, I'll show you how you can mask that. And the values change quite a bit too. Now, when you get a routine case, we've got a new product just being introduced called Blockout. And generally, when you've got variegated shades of teeth, you can put Blockout on and makes them all blend just without having to do anything special. And we also have the shade modification kit. And I think we're going to run into some problems in the gingival area with that deep gray. And I'll show you how to neutralize that. We're going to use pink Tetra Pak on that gingival area. And don't ask me why pink works, it just does. We'll have these different tips. But before we started, Elisa polished our patient's teeth with Lumineers polishing paste. I like to use that instead of pumice. And the reason I do is that if I use pumice, I just push plaque around. And I want to get rid of the plaque so I get a better bond. Now, the first thing we're going to do is use paint on dental dam after Lisa puts the cheek retractors in.
These lip expander in still.
And the paint on dental dam, when we put it on the lingual side, is going to enable us to clean up very simply. And that's our first molar, second bicuspid, first bicuspid. And we have removed the resin that's on there. So that's pretty challenging. Some people say you can't do that unless you remove a lot of tooth structure, but we're going to do our best today. And I think we're going to have a very significant improvement. And what I'm doing now is putting paint on dental dam on the lingual surfaces and lingual gingival surfaces of the teeth. And you'll see what this looks like in a few minutes. And it really simplifies the finishing a lot. And I put it over the occlusal surfaces of the bicuspids as well. When you put this in, if you have diastemas between the roots of the teeth, you want to be careful that you don't get it in the embrasures and prevent seating. Now what I'm going to do is take the 9mm tip and hold it about 3/4 of an inch, open wide, from the surface. Close your eyes. The best way to protect your eyes is to close them. And what I'm doing is partially polymerizing the paint on dental dam. Close your eyes. Close your eyes. Close your eyes. This takes about a minute or two. Now I want to check and make sure that I have this partially polymerized. I need that light again. There's some of the molar that I haven't set. I've never done molar to molar before on one of these webcasts, and I hardly ever do molar to molar on anybody anyway. Close your eyes. Okay, close your eyes. Okay. Let me just go back and check and make sure this is all in the rubbery state. Now we'll take another look. Wherever that blue is, we're not going to have any ultrabond bonding through the tooth. It'll greatly simplify finishing. Now I'm using the medium viscosity etch and seal. I like the medium viscosity. If you'll notice, I get to push it around exactly where I want it to be. And I have complete control. It doesn't run all over her mouth. Okay, just turn you over this way just a bit. And I'll show you how to handle these dark bands of tetracycline stain when we get to that stage. And I guess we can wash it off now. I like etch and seal because it contains aluminum oxalate. And if I get any on the dental tubules, it will seal them. So it's a desensitizing agent, so to speak, as well as an etching agent. Now we have a frosty look here. So we have a surface that's prepared. And then what I like to do is put some tenure AB on. I'm going to put tenure AB on everywhere. I like tenure AB because it's not light dependent. It sets with all, bonds with all composites. Okay, now what we've done is we've applied tenure AB and we've etched the maxillary teeth. So think about it. Right now we've applied 2 solutions to the surface of the teeth, and we're going to select the shade. We're going to put one on without any try-in paste, and you're going to get 1 shade. Now what you're looking at is not the color of what the tooth will look like when you bond it. And the reason is there's air between the etched surface of the porcelain and the tooth. And once the light hits air, it stops going forward and reflects back. So what you're going to get is the color of the etched surface of the tooth being reflected back. And then we're going to put one on with one that we think would be the right shade. And you'll see that they're different. And now we'll put this on with the Tetra Pak. And we want to see it oozing out. And this is block out. And we mix 2 shades together. The, what was it, A1, Lisa? And
B0 and B1.
And B0 and A1. So this is the true color what the tooth will be. And this is what we would think it would be if you just try them on. I never try Lumineers in without try-in paste. And I don't try in very many of them very often because when you do, everybody looks at it and they look for what's wrong. They're very apprehensive about what the outcome will be. Because of the complexity of this and the challenge we have with masking tetracycline stain, and we keep hearing that you can't do it, I did try these in. But normally, if shade matching isn't this severe, I don't do many try-ins. And we're putting tenure S all over the surface. So Ultrabond is not water soluble. The Ultrabond try-in is the same resin system that we have on the Ultrabond bonding system. So when we put tenure S on, in addition to cleaning the surface, we're putting a protective coat of resin on the surface that we have prepared. You see, a race begins between contamination and resin, and whoever gets there first wins. And so wherever I have the gray, I'm going to put some pink Tetra Pak. For some reason, it's really great at masking severe bands of gray. Pink is really a great color for neutralizing deep grays in low value situations. And I'm ready to start applying these. And we have to be fast on this now so that the Tetra Pak doesn't set on us. So we put it on the incisal area and gently seat it. Okay. Right central.
Right central.
And we'll just continue on the right side.
Right lateral.
Right lateral. Okay.
Cuspid.
Cuspid. Let's stop for a moment. And you sort of tap these into place, much the way a tile setter or a bricklayer does when they put the mortar on the teeth. Then we're going to go to the 2mm tip for 1 second. You want to be sure that you see excess everywhere. And I always stay away from the last tooth. Close your eyes. What I'm doing is spot curing these in place. Close your eyes. And I stay 1 tooth away. Now give me the bicuspids for the right. You want to move along on this because the tenure S will start setting the ultrabond. I gently make sure that I have these placed in place. Close your eyes. Close your eyes. All right, now we'll go to the left side. And I'm going to put etching on this molar. Okay. Okay. That's good. Now, since I have tenure S on the surface of those bicuspids, they're protected from moisture contamination. And we're going to get back here on this molar. Okay. What is this? Tenure AB? Okay. And give me a little dab of tenure S back there, and then we'll do... Okay. All right, and I put tenure S all over everything again just to make sure that it's protected. I want to put a little pink on here. Putting a little more on these because they tend to be a little more on the gray side. So it'll enhance the block out. That pink really goes a long way in masking the gray. Okay. Here we go on the cuspid. And we just gently seat these. First bicuspid. Most of the work has been done for me. I did the preparation, and then somebody contours these and defines them. I want to see a little bit oozing out everywhere. Close your eyes. Close your eyes. Close your eyes. Close your eyes. And close your eyes. All right, now what we've done is we have spot cured everything. So now these are pretty much set in place where they're going to remain. And I'm going to remove some of the excess. Now we're putting tenure S on this surface. And we're ready to put the molar on there. We're stopping right here because in this period of time of mixing the ultrabond and the tenure AB with the tenure S involved in it, it's now polymerized. So she's making some new. So even if you don't get the light on there, you're getting a lot of polymerization take place. But it won't discolor because it's a low level. Now let's take a look at the lingual side here. Open. And give me some brushes. And I'm brushing it all away. When you look back here, you'll see that some of it looks like it hasn't been brushed away. And that's because it's polymerized. Now we're going to take the 9mm tip and do a 5-second cure on each veneer. 12 of them. Close your eyes. And close your eyes. Close your eyes. Close your eyes. Close your eyes. And close your eyes. So let's take a look at the backside here. Let's take a look at this stuff in the backside. Now you see wherever you got that blue, oh, that's the other thing. Look at that stuff hanging down from the molar. Believe it or not, that has polymerized. It came in touch with the tenure S, and before we could wipe it off, it came out. Let's see, blow that little air on that. And then look at the lingual side here. Wherever you see that excess in there, it's set before I could brush it away. And that really isn't too bad. Now I have to do all this work. This is where a good RDA comes in, or your hygienist comes in, because you use the Shure 349 like a scaling instrument, but never use a scaling instrument on the porcelain. And the reason is that you'll scratch the porcelain. Okay, now we'll go on the lingual side, open, and we'll start picking off mirror. Somebody asked me why I didn't want to polymerize these all the way on the paint on dental dam. See how it starts popping off like that? Can you see that? And look how dark those teeth are underneath. It's hard to remember, isn't it? And because I had the paint on dental dam, that big chunk mounted to that molar just came off relatively easy. Paint on dental dam on the occlusal surface of bicuspids for the same reason as I put it on the lingual. It makes it easier to get the ultrabond off the occlusal surface. And what I'm doing now is just going around removing the paint on dental dam. Okay, now I'd like an ultrafine diamond. What are we doing now? We're doing cavity preparation, only we call it surface preparation. Then we bond it to that surface. This is a 12 fluted burr, and I'm going in now and removing the ultrabond, but I won't remove the porcelain because the 12 fluted burr won't cut the porcelain very much. And all I'm doing is going around the margins and separating the ultrabond from the porcelain. And I let the porcelain guide my 12 fluted burr, because the goal is to get rid of as much ultrabond as I can before I finish. And the reason is that I don't want to use porcelain remover. I don't want to use a porcelain diamond, because when I do that, I wouldn't be able to distinguish between cutting on porcelain or ultrabond tactily. And this way, when I come back in to remove the shoulders and blend things, I know I'm only going to be working on porcelain. And there's another reason I don't like to show the patient all of the Lumineers tried in. They never look as good on the try-in when you put them all in as they will after you start cleaning up these embrasures. So patients start looking for what's wrong, and they start to have a negative attitude. And then all of a sudden you spend all your time trying to convince them why what you did is okay. Now I'm just taking the ultrabond off the gingiva. You can see that flaking off. Yeah. You want to do that gently because I'm using a metal instrument here. Just pops off. But you can see how rigid this is. And that's why it works so well around the gingival margin. Wide. Now we'll go to the football-shaped diamond. All of these little instruments are in one kit called a finishing kit. I used to call them off, and somebody said, why can't you just put them all in a kit? And so we did call the Lumineers finishing kit. Now I'm just going on the lingual side and blending the Ultrabond and the tooth together. And I'm just indiscriminately removing anything that doesn't look like it belongs there, whether it's tooth structure or porcelain or Ultrabond. And I never get it all off on the same day that I place these. Now I'd like a long, fine diamond. What I'm doing now is blending the gingival margin and the porcelain. And this is why magnification is important, because when you start getting back in the posterior and you start going in the interproximal embrasure, it's really great to be 15 inches away and be within 2 inches of the interproximal surface. Okay, well, what have we done so far? We've done some of the finishing. Let's check the occlusion. Close. Gently grind your teeth around. Open. Close. Let's look at the occlusion. We got a mark on the cuspid, the lateral, the central, the lateral. Uh-oh, what's this up here? That's a little Ultrabond. This is where you're going to knock most of them off. Distal of laterals are the most commonly ones that break. See, we got a nice mark here, not too much back here. I'm going to take just a little bit off this lateral. And one of the things I like to do is I generally like to take a little bit off the distal. It gives definition to the lateral, and it allows for the cuspid to come through here without knocking it off. And I'll do the same thing on this side as well. This is called a seri saw. So then we just start gently sawing through the contact. And if it's a little tight, you rock. Now we'll take the seri sander. So all we're doing with the seri sander is getting rid of some of those rough edges a little bit so they can do a little flossing. So, just to show you the contacts are open. Okay. And let's see what Joanne looks like on the lingual. And then you can see the contrast between the color of their tooth and what we gave her. And we did that in about an hour and a half on 12 teeth.
Changed my life in an hour and a half.
Yeah, isn't that amazing when you think about it? And most people are petrified of going to the dentist. So there's so many things you can do with Lumineers. But it goes way beyond this is just making a smile attractive. But we can do a lot of restorative procedures like helping children, adolescent children, with fractured teeth without having to give them any anesthetic, and we can take an impression and make them look great. Let's give her a mirror. You gotta go over here. You like it? Huh? So with that, I wish you the best of the rest of the afternoon, and thanks for listening, and come down or call me anytime you want. And always glad to talk or help you. Talk with you or help you. Okay. Bye.
I chose to get Lumineers because I had looked into other products that would correct the tetracycline staining, and all of them removed tooth structure, and I didn't feel that that's something that I would ever want. And other than bonding, which wasn't really as effective, I was so frustrated until I found Lumineers. I thought, this is exactly what I want. I knew from the minute I read the information material, and then I ordered some of the marketing packet so I could learn more about Lumineers, and I knew instantly that's the only product I would want. It was kind of a pleasure. And especially because you knew that in just a few minutes, in a way, your entire life was going to change. I mean, that sounds a little dramatic, but for me, who's had tetracycline stains since I was a child, and people asking me, what's wrong with your teeth? And dentists calling in their assistants, have you ever seen such a case of tetracycline staining? I mean, it's been something that's weighed on me my whole life. So I can't really emphasize enough what a dramatic difference it is for me psychologically, as well as, of course, cosmetically. My family, I didn't see them immediately after having it done, and some of them didn't even know. And so I just went to visit them last week, and I was very curious as to what the response would be. And some of them didn't even notice right away. They just say, "Wow, you look great." And then they said, "Your teeth look beautiful." "Oh, that's right. You got Lumineers." And they all said that they looked natural. Nobody said they looked artificial. I feel so much more confident and uninhibited in my humor and my interactions with other people. It's like this huge weight is off my shoulders. I don't have to worry about, are people looking at my gray teeth?